County Hospital, and let the ones that they need to be in there come in here and talk.
Hey, you're on speakerphone.
Huh?
I'll try to be there.
Ain't got to be
Okay.
banned. Sure. Ain't got to be banned.
I'm gonna call this meeting at 4 o'clock. We're gonna talk about, the coronavirus. And we'll start with Mr. Barry in here, he's gonna tell us, I went to a meeting. this
We had
morning.
both sides, so we can't remember what came in here. And you can stand out there at the door.
Man, no.
Pull your chair out there to the door.
Hello, Jamie. I called this meeting at 4 o'clock. We'll talk about coronavirus. We'll start it off with Mr. Barry. I went to a meeting this morning and, he gives a good presentation, but, he's gonna tell us all about it, who won't need to do.
All right.
Mr. Chairman, Commissioners, appreciate the time or opportunity to come and speak in regards to your decisions. Obviously, as discussed this morning, any decision you make is going to be a difficult decision because any decisions that are made affects two of the basic principles of what we stand for in communities, and that's assuring that our folks have a safe and healthy environment and also a environment conducive to business. So either way, the discussion is difficult, and I appreciate what you all do. Just to kind of put things into context, and these numbers change by the minute, but as of this morning, just sometimes when you put numbers with it, it just kind of makes things a little better to perceive. So far, as far as world numbers, 435,006 individuals have been confirmed to have COVID-19. 19,625 deaths have occurred as a result. In the United States, we're sitting at 55,225 individuals that have tested positive. In the state of Georgia, as of 12 o'clock today, noontime, we are at 1,247 with 40 deaths. Just to give you an understanding, that number since 7 o'clock last night has jumped to 150 cases with 2 additional deaths. So every 2 days, we are seeing it nearly double as far as the volume of patients or individuals that test positive. Just again, a feel for around the area, Lawrence County has 6 individuals, Coffee County currently confirmed at 2, Ben Hill at 1, Tattnall at 1. We're starting to see that things are moving our direction per se. So far, we have had 24 presumptive individuals tested, meaning that they're symptomatic and need to be tested. So far, we've only had 4 results come back. That's kind of showing the issues that we're running into around this country is the fact that we do not have enough testing sites. We do not have the throughput as far as tests. Some of the tests right now, we're waiting on 7 days since we've taken those tests and still haven't gotten results back. But 4 have come back. They have all been negative. So far, we have 0 cases in Jeff Davis County. We're very fortunate with that. I sit here on behalf of the healthcare community making the recommendation that y'all put our community's health as the forefront of your decisions. Obviously, I am very understanding about the economic impact that those decisions make, but if we have people dying, then really does that really matter a lot? Right now, also my concern as being the CEO of Jeff Davis Hospital is the longer we wait and the greater potential that there is for further infection with COVID-19, not only are people putting their family and loved ones into harm's way, they're putting the hospital staff in harm's way, because every one of those patients are either coming through that hospital and having to be addressed and treated by the caregivers that work at Jeff Davis Hospital. And we already have experienced the fact in Albany and Daughtry County, they've already had one caregiver that has succumbed to COVID-19 through the process of giving care to other individuals. I think if you've looked around, numerous physicians currently have come down with COVID-19 and have passed away as a result of that. We can see for the fact of waiting what's happened in regards to New York. And right now, New York is out of control. They have no way of getting their hands around the circumstances and situations that's in front of them there. Needless to say, as mentioned this morning, we are very fortunate that we're isolated as a rural community. And that's great news. We do not have a large metropolitan population that's on top of each other like they have in New York City. But at the same point in time, I think if we use Albany as an example, it's a perfect example where two individuals participating in a funeral are the ones that started the passing of the COVID-19 virus. And as a result, they have well over 100 cases now and 8 or 9 deaths, I believe, over in Albany. We do not want to be in that type of circumstance here. So my recommendation is social distancing, reducing the opportunity for folks to be together in larger groups, and basically trying to keep people at home and away from others, in family groups, and try to control it there. I think we're finding out that the more people are to themselves and by themselves, the less that this is going to spread and the better off that we are. One of the scary things with this virus is, as it's stated on the news, this is a silent killer. This is one of those things that people have the virus, never show us symptoms, and are passing it on, especially with our young folks. And I think we also have the false perception that if you're young, you're not going to get this. Well, guess what? In the United States, 50% of the cases that have the coronavirus are under the age of 45. 50%. And right now there's a 12-year-old sitting out at Children's Hospital of Atlanta that's in the ICU struggling for life with COVID-19. So it can reach down to whatever age. I think that's a false assumption to think this is only for elderly and those individuals that have other comorbidities. That is not the case. So I just bring that to your attention. Here to answer any questions if you have any.
So you recommend social distance, so what can you?
Again, I'm promoting that we leave no stone uncovered. I think we need to shut down non-essential businesses. I think we need to shut down social gatherings. I think a lot of the recommendations that I see coming down are the fact of even events such as funerals be kept to 10 individuals and family members only, weddings the same way, the holding of church services via Facebook Live or other aspects, even essentials such as restaurants, etc., only being takeout or being curbside, nobody going into the facilities. I think any of those types of items, the more that we do, the better off we're going to be as a community. And hopefully, as we get through this, we'll still be one of those counties that have 0 cases and 0 deaths. That's obviously the overall goal. And you as an organization, you as a commission can make a determination of what that length of duration would be. I know this morning they had voted on to April 15th, trying to give a little over 2 weeks to try to see what is going to happen in our area. But my recommendation would be to do the maximum that you feel you're capable of doing.
What about supplies at the local hospital? How are you on that?
We're blessed in the fact that we've had people that are bringing some items to us. We are no different than anybody else. We're fortunate that, in my opinion, we have enough to probably carry us for a couple of weeks based upon the supplies that we have. Right now, we have 5 individuals that are presumptive patients, so they have to be treated as a COVID-19 patient. The problem with that as well is the fact that every time you go into that room, you have to change out all of that protective gear that you're wearing to make sure that you're not cross-contaminating. So we have done a lot of things such as providing a certain quarantine area in our hospital for those patients and sealing it off with barriers, both in the ED and in our inpatient areas, and trying to assign one nurse to those folks so that we're not burning through the PPE, the protection equipment that we need to hold on to. We have about 3,000 of the N95 masks. However, we go through, with those patients and with the patients coming into the ED, we're going through about 150 a day. As we get more patients, obviously, that will grow substantially. But we were looking for other resources, hand sanitizer, alcohol, N95 masks, gowns, all of those things basically are all on back order. So we're looking for the state and federal government to try to facilitate some of that. Some of the things that we have been noticing as well, as I had mentioned this morning, it's pretty alarming. You want to think, especially during times like this, that most people are going to be easy to work with, etc. But the vendors that we are finding that have the masks, etc., an N95 mask prior to COVID-19 cost us 30 cents a piece. Right now, we're getting quoted for $10 a piece on those masks. And we are turning that over to the district attorney's office, the state district attorney's office when we run into those. But I'll be honest, we haven't found any less than $3. That's 10 times what we normally pay for. So, even when you're looking at are they available, yes, you can find some on occasion. But when you do, the hospital's economic impact is significant, just trying to get those items in place to make sure our staff's protected.
Manny, any questions?
I just appreciate what you do, and I know y'all in harm's way, but this is still going on. It's something none of us have ever seen.
Nothing we've ever experienced and hope we won't again.
Chief, you want to now explain some kind of...
Thank you for your time.
Just a few things. So far, the youngest one in Georgia has been 33. And I think 95 is the highest. Most of these right here, this is statistics right here on the folks that passed away by county. And basically, most of them, a good portion of them had underlying issues before that. But this is terrible. This virus is awful. One thing I want to say, in the last several weeks, we've been pushing out everything, social media, fire department, Facebook, the EMA Facebook, city's been pushing out stuff. Everybody's been pushing out, as we got guidelines. And one thing about our guidelines have changed and changed and changed. The way we procure stuff has changed and changed. So we've been trying to stay on top of that. But I'll tell you, I'm proud of the citizens in this county because about 75% of the citizens we got are obeying and doing what they need to do. But you've got about 25 to 30% that is not. And the likelihood is we're going to have to maybe force some of this stuff to the point where they understand, they got to abide by some of the guidelines. And basically, and I think the city's going to make that change today for the city side at 6 o'clock. And talking with the city attorney, he and I had a good conversation today. And I think what we're going to end up doing, the city's going to end up doing is leaving, not closing everything, but non-essential stuff that we have in the city that does not have to be open, that's going to be closed. And then it's going to basically be back to what we talked about earlier, that the restaurants will be drive-through or it'll be curbside. I mean, something, come to that point, that, and then takeout where you'll go to the door, they'll come to you, get your order, and bring it up to you, so there's limited contact. And I think that for the most part, you'll see a lot of our industries that have started distancing people in some of the rooms they have, like the break rooms. I think that, if I'm not mistaken, I've heard Adams Mills is gonna shut down today at 6 o'clock, and they're gonna be down for a little while. So that's gonna be a good bit of people that are gonna be home, or they're not gonna be in one area. A lot of places have made provisions, you know, not having as many people time clock. So for the most part, our industry and our businesses have tried to do the best they can. And sometimes that just is not good enough, because you still have people that are trying to congregate in certain areas. The churches have done a phenomenal job. Most of the churches have quit having service, or either doing it online. You know, they've got, some of them, they've got some FM transmitters, and they're setting up and transmitting, going to the old theater about years ago. They're actually sitting in the parking lot in their own vehicles and watching church service. So people have come up with, you know, interesting ways to make things happen and keep moving like we're moving. But, you know, I've talked to some of the EMA directors around us, and a lot of people have made some of those things. Some of the city counties have went together and said, you know, about the businesses, and also set curfews. Some have a volunteer curfew from like 10 o'clock at night to 6 in the morning. Some have a mandatory. That's at your discretion. If you set a curfew, it's your discretion whether you make it mandatory or volunteer, and it's your discretion what to set that curfew. But also know that you need to have provisions in there that allow for people that need to be moving around in those times. People that are, you know, going to, you know, maybe working in the hospitals, doctor's offices, things like that. They need to be moving. Now, some people move earlier than 6 o'clock in the morning. Some people are moving at 5 o'clock in the morning. Farmers are out moving a lot of times before 6 o'clock in the morning. So, you know, we've got to be careful about how we put provisions in there, and then how we're going to enforce it. And anything you do, basically, is going to be up to the police department and the sheriff's department to make those things happen, or they're going to have to enforce it. It's going to be more of a load on the sheriff. He's going to have to, you know, if you enforce certain things. So, I think we have also sent up a request through GEMA for some supplies for law enforcement. Haven't heard back from that yet. I don't think, Sheriff, have you heard anything from them yet?
Blake texted me back last night, said he talked with the guy on the other end, and he said that he assured him we had some coming.
Good. And I know, talking on the healthcare side, from the EMS side, I think Roger had requested some stuff, and they didn't even have any hand sanitizer. So we're trying to figure out if we're pulling from one big warehouse or different warehouses. Not sure about that. But some areas may have certain things, some don't. So we're looking at supplies. We in emergency services do have a few N95 masks, but we started trying to buy some here a few weeks ago, and we were limited to what we can buy, and they just shut us off. So now we're trying to get masks through the state, through GEMA, the center request. So I know y'all got a tough decision to make. If we're going to do a state of emergency, probably if you're not going to enforce the same ordinances and things that the city would do, then we probably need to do 2 states of emergency, one for the county, one for the city. We can do a simple state of emergency, and then y'all can come back and tack ordinances and resolutions to it if you want to. I'm seeing that both ways. I'm seeing people that do simple ones, and they attach things to it, and I see some that are very comprehensive. They take their state of emergency, and they put everything they're going to do in that state of emergency, but you don't have to. You can attach stuff to it. So the thing y'all got to decide is if you're going to do that, and if you're going to look at things that are a little bit different than the city, then we have to have two. We have to have 2, one for each. So, anybody got any questions?
Sure, what do you think about that? Well, my opinion is between 10 and 6, 10 at night and 6 in the morning, you've got the least amount of people out moving around anyhow.
Yeah.
But I reckon if they are congregating, you know, in them times, I could understand when you could kind of go up to them and tell them they need to bust the crowd. But that's probably the least travel time of the 24-hour day is from 10 to 6.
I heard in Coffee County, there's from 6 to 9, or from 9 to 6. Is that?
That's correct.
What is that?
Yeah, there's different ones, and, you know, some's got it from 8 o'clock to 5 o'clock. I mean, it's just, if you look at what every city and county's putting out there, they're all just different. I mean, nobody is basically the same.
But this isn't just to keep the people separated, this is all what this is about.
And I spoke with the governor right after lunch or right before lunch, right during the lunchtime. I talked with him and he said his position has not changed since he made his announcement and his recommendations of last week. Thus far, his position hadn't changed. Keep a distance, maybe shut down your lobbies, and just keep crowds busted up within the back of your mind, you know, of the economical backlash that could have on it. But by no means, he's not giving us any recommendations. He said it's left up to each individual entity as its own to come up with your own guidelines and policies of what you want to, you know, how you want to do it. But, you know, he will not give any recommendations of how to, you know, what to put in place to enforce. But his position as the governor of the state has not changed anything since he gave his announcement last week.
And if I could, I don't know if y'all had a chance to read this, where city attorney presented this. Anyway, basically, this is the one that I've seen, I'm getting from just about every county, other than a county that's, you know, had a large number of cases. They're a little more strict than this, but if you start, if you look on page 4, start at section 7, that's basically where it starts saying what the city has enacted. And basically it's talking about, you know, as the chief said, about the eating establishments, you know, asking them to close all of the dining areas, but, you know, not close, period. You take out and the curb service. And then if there's a restaurant that also serves alcohol, they can sell the alcohol as long as it's closed up. And then it goes to the next paragraph, the closure of certain businesses. And you can see the type of businesses that are closing. It's basically like where he said, where you got large groups of people gathering, or either you have extremely close contact with another person, such as, you know, where you go to jail or something, or, you know, where you go to the gym to work out. You know, they go to amusement facilities, bowling alleys, things like that. That's what they're closing. As far as your big factories, they're not even talking about doing anything with those. They're just asking the owners to, you know, like you said, to basically do what you can to separate employees, to make sure they stay apart. And, you know, post things in their break room and such. But they're not talking about closing any of those. So, and then I think their curfew, they chose tonight, and you don't have to choose tonight. It was from 10 to 6. So, and then you'll see under there all the exceptions of the exempt individuals from the curfew. People like to have to go to work during that time, if we go to the, you know, emergency room, different things, grocery store. But you can read all that. As it, like I say, this is the one that most counties are using. Look, there's no real counties around us. Not that many have adopted one of these yet. Some of them have, but like you said, Coffee County has, but the other counties around us, Telfair, I think, has. The others have not, but this is the one that most of them want adopted. Because it's the least restricted, like you say, you're not hurting your big industries. Yeah, you're hurting your smaller businesses, but. And that's just an example.
Can I add one thing?
Sure.
The only thing with this, once you do it, be prepared to start answering questions, because you're gonna have, auto parts stores gonna call, they're not vetted. There's gonna be a lot of things people are gonna call, is me, am I? We've already had, I've had that today, I know I've fielded probably 30 calls today about people wanting to know if this is gonna affect my business. And then you've got some businesses, some industries that have already been deemed critical industry, so they're under, even under the governor's policy, they're not covered in this anyway, because they're critical industries. But you're going, you know, city and county both going to have to field a bunch of questions, whether I am or I'm not. So it's just going to be a couple of days of telephone calls.
And I think, like you had stated earlier, and you had too, but a lot of these businesses, you know, like hair salon, from what I hear, they've taken it upon themselves to shut down. They've already done that. So,
Andre Taylor sent out an email earlier about what the Georgia Chamber of Commerce are suggesting. And in there, they do have a link to all of the essential businesses, and it is extensive. So a vast majority of the businesses fall under needing to be open anyway. Because they, you know, the forestry industry is one they're saying is essential. Obviously, all agriculture, food, you know, anybody that delivers to those industries have to be available, et cetera. So the list is very extensive as far as those that are essential to continue to keep business going.
and I'm not recommending you follow this, I'm just saying this is what the city, you can't do something, or you know, you don't have to adopt it. You know?
And we
It's
talk
like
about,
Chief said, you should go ahead and declare a state of emergency, leave it at that, and then go back, see what happens in a few days, and then if you want to add different restrictions, you can.
and we're talking about small business, I mean,
Well, it's mostly entertainment. It's
yeah,
not really
but
business.
now my deal is Walmart. You know,
That's something.
Essential.
That's something.
It's a grocery
It's a
store.
grocery store.
it's essential
Yes.
It's a grocery store.
to have
And a
100 people in
pharmacy.
there.
And a pharmacy.
You know, I just got a question about Walmart. You gonna sit down the little man, but you gonna let the big man run it, and that kind of stuff.
I think, if I'm not mistaken, places like Belk's and all that, I think they're having to close because they're not deemed essential. But when you go to look at Walmart is a grocery store, they are deemed essential.
Like, also, I think Homeland Security is done, deemed them essential. That's nothing.
But I don't agree with them on everything.
Rhonda?
Just however many square feet the facility has allows so many in the facility, such as Walmart. You know, it may be 10 for a smaller business, but it may be 100 for a bigger business at the time.
If you look at the city of Douglas, their declaration, they went as far as to broaden that out. They've got 0 to 5,000 feet, and they got it all the way up to 100 feet or 200,000 feet. So they've got it broadened out how many people could be in that building.
Who would police this? I mean, if that was put in effect, who would police this?
And who would enforce it?
That's the thing, and that's the thing we were talking about at the city meeting. The only thing we know that is that it would fall back under, for the city, it would fall back under the police chief. The county would fall up under the sheriff to have to police that.
That'd be hard to enforce.
It's gonna be tough.
And I think the lady that had the reverse for Walmart, she worked in Walmart. She put up stock in the grocery section.
But keep in mind, you've got majority of your people that have done pretty good.
Yeah.
But you got people that haven't, and people that are still trying to congregate and get together. And that's where, that's gonna cause the healthcare part of our system to work.
I mean, I read this, and most of it is, well, the majority of it is, I think, spot on. You know, what the city's got wrote here, other than a curfew, I just really don't know what that's going, I don't know what that's gonna help. Like the sheriff said, I think 10 to 6 ain't nobody out anyway. Except people from Enfield.
Well, you don't have, that's one thing, you can do a declaration and you can leave that out. You do not have to do that. It's entirely up to this board of what you want to do.
I wouldn't fight it, I mean, I'm gonna be in bed anyway.
I got a motion that we put an ordinance in place.
What you gotta decide if you want to do a declaration, declare emergency.
We don't want to clear the emergency.
We probably got to do
Or,
that.
you know, first, you gotta decide, is that all you wanna do? At this point, like Chief Washington said, you could just do that, and the way that you wanna add these extra provisions later, you could, or do you want to add that? That's what your motion needs to be on those two, or
I'm gonna say this, I think the closing of these businesses, that's kind of a city thing, because most of it's in the city. But them big industries, that you can't close them. You gotta let them go.
Well, I mean,
It
that's.
ain't, that's right, it ain't on there. But the city's got to deal with it.
You there?
Yeah.
You go ahead.
Real quick, I was gonna say exactly what Van said. I mean, as far as essential businesses and all that, that's addressed with the city. I mean, if we declare a state of emergency, that's fine and dandy, and we keep everybody on alert, but as far as essential businesses in the county, there ain't that many of them. If there are any at all, so, I mean, really what we're talking about is just, whether or not we're gonna impose a curfew, which I'm kind of like, I've heard commented, it ain't really gonna do any good because nobody's on the road anyway. So my opinion would be, we declare a state of emergency and let the city handle the essential business part because 99% of them are in the city.
I like that.
So we'll have to have two separate.
just make the motion to declare a state of emergency, and that'd be it. If that's all y'all want to do, then.
You want to say what he just said?
No.
He gonna make that motion? Yeah.
I'll make a motion that we declare a state of emergency in Jeff Davis County.
I need a second.
I'll say.
Any discussion? All but,
I raise my hand.
Five. And you said we could address it as we need to.
I can draw the state of emergency and give it to the chairman tomorrow. He can sign it. I'll send it up to Jima. And then if you see something you want to attach to that, I can always send that up through WebEOC as well, and we'll have it documented.
go ahead, Ron.
I have a question that's been asked on Facebook. Where does the school stand in this? I know y'all can't speak for the Board of Education, but the school has only been closed till March the 31st, if I'm correct.
I think there's somebody else.
Ask the superintendent to come in and tell us.
Put you in the hot seat, sorry.
Do y'all mean, fine right here?
If you want to say.
If we're doing this, y'all close to it. Is essentially because we're not able to, when you look at the emergency plan and how it looks, we're not considered critical infrastructure. So with all that, if we do declare, you know, that's y'all's decision, I can't affect that, but we've closed school. When at this point, the governor's got a mandatory closure that ends on the 31st. So then the other piece I would like to kind of talk with you guys about is we're delivering meals to students right now, and I've got a lot of concern within the district about them doing that because you're putting them, exposing them, and they're over the 10 allotment, but where does that fall within?
I would deem that necessary. I gotta eat.
This program has been endorsed by the governor, so I would think that would fall up under a critical event going on right now, because it's endorsed by the state school system, so I think you would be fine, you know, but I understand your concerns as well for your people, and you might want to make sure they're distanced back, and, you know.
They can't prepare meals within the 6 foot. I mean, they're on top of each other to prepare them. So, I mean, and that's, Pulaski County's already shut it down. I believe Pierce County has as well. But how does that fall within this? I know I've received feedback, Appleton County's changed theirs, if I'm not mistaken, to 1 day a week versus 5 days. So there's a lot of moving pieces, as y'all are well aware of. But how that falls within this is what we will have to kind of figure out.
Your concern is not in the delivery side of it, it's in the prepared side of it, is that correct?
Both, because, I mean, we're talking about how we're doing restaurants.
Yep.
You know, essentially what we're doing is providing restaurant services. And we're putting the school employees in the same situation that we're worried about with restaurants. It said those sites, you could have more than 10 people at the site picking up meals. So,
Have y'all got any clarification from the state on that?
and that's been very disappointing. We were hoping we would, and basically the guidance we got yesterday was following CDC guidelines.
And that will be my recommendation, to follow the guidelines. Is Roger up there?
Roger left when y'all wouldn't let him come in.
We can't have him in.
You, Mr. Rainey?
Only thing I asked is a question on timing. The city is going to put this, as far as the curfew and all the things that we've got there, in effect to the 15th. And just making that a point.
And you don't know if they may add to this school. I'm gonna about bet it'll go right on.
And I agree with you, Mr. Van, I think it would. The whole reason I haven't made any statements is we were anticipating sometime this week the governor making a statement, and I still anticipate that could happen by the end of the week. So it could extend. Now, is it going to extend to the end of the school year, which some states have done? Is it going to extend, to maybe a timeline, what we're talking about here, mid-April? I would anticipate us hearing something, but you're exactly right. It definitely could extend.
I would, if something changes in the way y'all do it, I would love for the city and the county and the school board to meet together and address this, because feeding them children is very critical. I mean, we've got to do something. I don't know what we'll do, but we got to do something. So if something changes for y'all, I wish you just let us know, and maybe county, city, and the school board can work together and find a way to make this happen.
And I think we can. We got a very, the population that work with our transportation department and with our food services are typically older. And so when you have them, that's the population you're most concerned about, and if they do have pre-existing health conditions. So the district has had a phenomenal response of people volunteering and helping with this within the district. And I've had people outside to ask, but I haven't went there yet because we haven't had that need, but we may be getting real close to that. But I agree with you, we're averaging Monday 820, and I think we were over 820 again yesterday. I didn't get the numbers today, but students served
820
at the different site locations. That's how many, and they're getting a lunch and a breakfast when they're there, so that's how many people were.
Wow.
That's so much. Are y'all delivering with a bus?
Most of the time, yes, sir, we're using the district van. We got 2 vans and the mini buses, and we go to different sites throughout the community, and we set up pickup locations. The real concern I have at those points is you got everybody kind of congregating up, especially when we go to the apartment complexes. It's not a drive-through situation, but, access to these meals is a big problem for people. So by us going to different locations, it might be where we stop and you have everybody come up toward the bus.
Tell us how we can help.
I mean, can we put people out there that's limited to the amount of people that comes up there? I mean, you said, oh, you can, wait a minute.
Yes, right, you could. And it's not always going to be an issue, and it's sporadic when they show up. We are there typically between 10:30 and 12, but you're within that 6 foot anytime you hand that bag to them.
How tough would it be to convert some of these locations to a drive-through? So they're gonna have to drive by to pick it up.
We could. Now, some of your districts are doing that. The problem that you run into with that is access. If people don't have vehicles or they're working, the kids are at home, they don't have transportation, so that's why we did so many different sites to try to reach as many kids as possible. The only other option that may be the one that the district has to look at is just running a bus route and trying to find those kids on a bus route. That would limit one stop per, meal delivery. So there's a number of different things districts are doing right now. I just need to kind of figure out how that fits in with what the city and county are talking about.
I mean, I think bus routes are a very smart thing, and I'm sure y'all already budgeted for the bus route anyway, so that may be the best option.
The reason we didn't originally do that is not every kid that rides the bus needs a meal. So it's a matter of finding those kids that don't ride the bus.
Anything else?
I've got one more thing, Mr. Chairman. This tax collector asked me to present this, and I know it's not on the agenda, but considering the circumstances, this is kind of an emergency action too. Since we're not meeting again until the middle of April, the governor in his order the other day has allowed for the governing authorities to waive penalties and interest for people that pay their ad valorem taxes on the mobile homes later because they're due April the 1st. And it's up to each governing authority if you want to waive that. Not because of the negligence, if the person is being negligent, just willfully not paying it. But if there's certain circumstances, that they are sick and can't get out and can't get here to pay it, that's the people that they're going to bring before you to waive. So if y'all
If they were sick.
Yeah, if y'all want to consider that, that's certainly available. And if you want to, you need to vote today because the deadline is April 1st.
And if their job, if they not work,
Yeah, if they're.
Can't pay the tax. Not just
You know, with
cities.
proof, I'd like to make a motion with proof of any hardship that we would look at it and consider it.
I'll second.
Any discussion? All vote?
Thank you, that's all.
Anything else? Meeting's adjourned.
Thank you.